So there are three components. There are the cylinders that get implanted into the penis itself. There's the pump that goes into the scrotum, and there's the fluid reservoir that goes higher up beneath the abdominal muscles. So the way that we put this in, first is general anesthesia, so the patient's completely asleep, doesn't feel anything. And we make an incision right here at the junction between the penis and the scrotum, and that allows us to put the cylinders into the penis itself. It also goes back into the base of the penis that you can't see. And from that same incision, we are able to put in the pump that's connected to the cylinders by tubing that's all underneath the skin. And then we make a small incision up here to put in the fluid reservoir, which is just a little, basically, balloon that contains the extra fluid. And then this is all connected through another set of tubes that are also beneath the skin. And this is just a close-up view of the pump itself. It basically has two components. There's this part that you pump to fill the device. It's very straightforward. There's no kind of magic to it. There's no on-off switch. You just push it and release it. And you have to do that several times to get all the fluid into the cylinders in the penis. Then when you no longer want to have an erection, you just push this button up here, which is also very easy to feel through the scrotum. And you just hold that down, and that allows the fluid to go back into the reservoir. Usually we'll have patients squeeze the penis at the same time gently to help push the fluid in to the reservoir more quickly. And then this part here is just where the tubing enters, and that's all, again, hidden beneath the skin. So unless your partner, you told them that you had this in, they would never know that you had this. And definitely, walking around the locker room or anything, nobody would have any idea that you have this in.